Well, good afternoon, everyone, and welcome to the COVID-19 update briefing for Friday, October 23rd. Today marks our fifth conversation since we returned to daily briefings last Monday, and we've seen upward movement in our COVID-19 data for each of the last 5 days. Last Monday, our lowest positivity was Region 11, that's Chicago, at 6.2%. That was Monday. Today, Chicago is now tied with Region 2 in north central Illinois at 7.0%. That's a 0.8% increase in just 1 week. Chicago's infection rate is rising at a rapid rate, just like the rest of Illinois. Statewide, the number of patients hospitalized with COVID-19 has increased 17% over the last week alone. As of Monday, only one of our 11 regions have been moved into increased mitigations of our resurgence plan. Today, that number is up to 4 regions: northwestern Illinois, southern Illinois, and Will and Kankakee counties, that's Region 7, DuPage and Kane counties, that's Region 8. With Region 4, Metro East, crossing the 8% average threshold for the first time today, or at least since the last time they were in mitigation, and Region 9, Lake and McHenry counties up on the Wisconsin border, close behind with a 7.7% average as of this morning. Regions under tighter mitigations sometimes take more than a week to see the numbers start to level out or come down, but it happens quicker when people in a region make personal efforts to follow the basic mitigations immediately. What we do today, October 23rd, will determine how many cases we have and what our hospitals will look like on Halloween, just 8 days from now, and at Thanksgiving, just 34 days from now. Following public health recommendations, especially wearing a mask in public, will bring our numbers down, save our economy, and let more of our kids go to school, getting us as close to normal as we can be until we get through this. And here in Illinois, we continue to do everything we can to slow the spread of the virus and move us toward that normal. Every day of the last 8 months, we've gotten better at tracking and monitoring this disease through more and more testing, making sure that your individual efforts to protect yourself and your community are matched by our efforts in government. Ours is not one of those states that started to build up its testing infrastructure in March and then slowed down in July. Illinois now has surpassed a 70,000 tests per day average, which means that we test 3.5 times as much as the average state, and we're third in the nation in daily testing and number 1 in the Midwest. Each day we do more testing at our 26 state-run sites and 3 IDPH labs alone than most of the states in the United States do. In every state where they combine state sites, private sites, hospital sites, doctor's offices, and anywhere else, we're exceeding those in a combined basis, just in our 26 state-run sites and our 3 IDPH labs. One of the key elements of our testing success is that we have built a mobile testing system that can be deployed anywhere in the state, with an emphasis in areas with documented outbreaks and increasing positivity rates, and where local public health departments indicate that there's a greater need. Decisions on the location of mobile testing sites are made in part on the submission of mobile testing site request forms on our IDPH website, where anyone can submit an area of concern for consideration. From there, IDPH works with our mobile team operators to evaluate all the information and to get our teams across the state in as equitable a manner as possible to urban and rural and suburban communities alike. In the last 2 weeks alone, we've had mobile teams present present in 47 counties throughout the state of Illinois. These tests are free to anyone, regardless of citizenship, symptoms, or contact with someone with COVID. And they're also fast. I know that throughout this pandemic, there have been national headlines about the long backlogs, sometimes 2 weeks, at commercial labs, national ones, that delay you getting your test results. Well, that's not the case at our in-state, state-run, community-based testing sites and our mobile sites. The majority of people who go to these state-run sites see a turnaround time for their results in 2 to 3 days. And for many, it's even faster than that. This is key because the tests that we offer at our state sites are PCR tests, the most accurate kind of COVID-19 diagnostic test out there. You can find the closest one nearest to you at dph.illinois.gov/testing. Mobile testing has allowed us to evolve where and how often we need to offer testing in a certain area and increases the availability of free testing as needed. Next week, for example, we're piloting a month-long, semi-permanent, 7-day-a-week operation in Mount Vernon in Region 5, Southern Illinois. And we are currently identifying locations in Region 3. This is the work that it will take for us to get through this. And let me be clear, we will get through this. Our strong testing regimen is just one important tool in our toolbox, and we didn't have that toolbox prepared when this pandemic first hit. No one did. And there are others that we have deployed, which we will talk more about next week. Navigating new challenges with Illinois ingenuity and grit is who we are. From expanding testing for everyone, everywhere in our state, to calling on the Republican-led U.S. Senate to get federal support for our Illinois small businesses, we won't stop fighting for our state and for each other. We've got to be all in for Illinois. So now I'd like to turn it over to the Director of the Department of Public Health, Dr. Ngozi Ezekie.
Thank you, sir.
Thank you.
Good afternoon. I do want to say happy Friday, but I understand the mental, the social, and the emotional toll that this pandemic continues to have on people. It's not just because I'm asking people, it's because I'm feeling it and living it myself. I don't get to live in some COVID-free bubble exempt from all the pain and the tragedy of this pandemic. So I understand how pandemic fatigue is striking everyone. It's real. People are tired of not seeing their families. They're tired of postponing the weddings and the other life celebrations. Trying to work from home while also trying to manage kids learning on remotely is a challenge, not being able to visit your loved ones in long-term care and nursing homes. Not being able to gather with groups of friends for a night out in your favorite restaurant is getting to be a lot to bear. The way we work, the way we live, the way we play has all changed, and the harsh reality is that the sacrifices we've made and that we continue to make do not have a future expiration date. And I know that that's difficult. This new virus has caused this horrible situation, and although people want to refute the number of cases, we are seeing the number of people with COVID-19 continue to increase. We are seeing the number of individuals in the hospital because of COVID-19 increase. We are seeing the number of lives lost continue to increase. And if you're tired of hearing it from me, please just ask one of your local physicians in the area. They will tell you what they are seeing in their hospitals. Since yesterday, we lost an additional 31 lives for a total of 9,418 deaths. These are people who started with us in 2020 and won't be with us at the Thanksgiving table. Today, we are reporting 874 new cases for a total of 364,33 confirmed cases since the start of this pandemic. Excuse me, please.
Get a Kleenex. Thank you.
I'm sorry. Okay. We have had 364,033 cases since the start of this pandemic. 2,498 individuals were reported to be in the hospital overnight. Of those, 511 COVID patients were in the ICU, and 197 patients were on ventilators. In the last 24 hours, 82,256 lab tests were reported for a total of more than 7.1 million tests. My message to you is to stay strong. I've never run a marathon, but I have the utmost regard for those who've been able to train and plan and finish a marathon. But this is a difficult race when you can't actually see the end point, and I'm sorry that that's the message I have for you. Nevertheless, I'm asking you to fight the fatigue. Fight the urge to give up on social distancing. Fight for your kids to have safe, healthy opportunity to have in-person learning in school with teachers who were trained to teach them in the classroom. Fight to have safe, healthy environments at which we can work, so that businesses can remain open, so that our economies can start to thrive again. This does mean wearing your mask anytime you're around people. This means reconsidering that large gathering, that large social event. It means thinking about wearing masks in your own home when you're with other people from outside of your household. Think about connecting with friends and family virtually. This is what we'll have to do to bring the spread down in our community. When we bring the spread down in our community, kids can go to school safely, people can go to work safely, activities, family celebrations can be celebrations instead of super spreader events that result in disease and death. Let's please work together. I know many of you are healthy and don't have a concern in the world of dying from this COVID. I would say that, of course, there are some people whose chances are much lower, but let's please think beyond ourselves and think about the people that we could unknowingly infect who may not be as fortunate to have the immune system and the healthy status that you may have. We literally have people who are asymptomatic, meaning have no symptoms for the entire duration of their illness. And so for those 7-8 days that you may be shedding the virus, you are unknowingly, unwittingly infecting people in your path, people who will never know that they were exposed to you, but may come up with disease and maybe even be hospitalized and even worse without ever understanding where or how they contracted this. This is how this disease is happening, but we do have a choice. We can limit our gatherings, we can wear our mask, we can wash our hands, we can do these things so that we don't hurt those around us. Buenas tardes a todos. Quiero que mi gente latina sepa que realmente entiendo el costo mental, social y emocional que está causando esta pandemia. La fatiga pandémica es real. La gente está cansado de no ver familia en las bodas, las quinceañeras o otras celebraciones de la vida. Muchos de los trabajadores esenciales son latinos y los agradezco a todos por trabajar durante esta pandemia de mantener funcionando nuestro Estado. La forma en que trabajamos, vivimos y jugamos ha cambiado y la dura realidad es que los sacrificios que hemos hecho y estamos haciendo deberán continuar en el futuro. Es difícil de decir eso, con los días festivos acercándose. Sé que todos queremos estar juntos, pero no pongas en riesgo a la abuelita y abuelito. Usa una máscara durante su visita. Eso ayudará a detener la propagación de este virus mortal. Algunas personas quieren refutar la cantidad de casos, pero estamos viendo que aumenta la cantidad de personas con COVID-19 en los hospitales, así como la cantidad de vidas perdidas. Usted puede preguntar a cualquier doctor que conoce para confirmar eso. Desde ayer hemos perdido 31 vidas adicionales para un total de más de 9,400 muertes. Hoy informamos 874 casos nuevos de COVID-19 en Illinois para un total de más de 360,000 casos confirmados. 2,498 personas en Illinois pasaron la noche en el hospital con COVID-19 y de ellos 511 pacientes estaban en la unidad de cuidados intensivos y 197 pacientes estaban en ventiladores. En las últimas 24 horas se informaron más de 82,000 pruebas de laboratorio para un total de más de 7.1 millones de pruebas. Mi mensaje para ustedes hoy es que se mantengan fuertes. Luchen contra la fatiga. Luchen contra el impulso de salir sin máscara. Luchen para que sus hijos podrán aprender en manera segura, saludable y en persona. Luchen para su familia, sus amigos y su estado. Porque no podemos hacerlo juntos, tenemos que trabajar juntos. No puede hacerlo solos. Sí se puede. Recuerde los 3 M's, usa su máscara, mantenga su distancia y lávense las manos. Muchísimas gracias para su apoyo. And with that, I will turn it over to Governor Pritzker.
All right, reporters in the room, we're going to take a couple from you guys, and then we've got a bunch of people who are working from home with questions.
And before we begin, I just want to say something important. Dr. Ezekie is superwoman. Since the very beginning of this coronavirus, she has had the weight of the public health of the people of the state of Illinois on her shoulders. She has worked nonstop, 7 days a week, 24 hours a day. There is not a moment that she doesn't take a phone call in the middle of the night, middle of the day, take a meeting, whatever she needs to do. The people of the state of Illinois are her patients. And you can imagine she cares so deeply about her patients. And I'll also say that there is a tremendous amount of pressure and burden when, in addition to all of that, she is subject to verbal attack, to protesters showing up at her home. And people have a right to do that, but people should take into consideration that this is a very difficult job that she has, and she is doing it in a way that we should all be so proud of. I know I am, and I'm very proud to be able to work with you, Dr. Ezekie. Thank you. So with that, I'm happy to take any questions from members of the media.
Yesterday, you had mentioned that you're going to send Illinois State Police to Region 1 to make sure that they're complying, that they're not having the bars and restaurants open. And if so, are they going to be making arrests?
No.
And what would be the criminal charge if there is one? Because it's a health guideline, right, and an executive order?
No, as you know, we had a regulation passed, an emergency regulation that allows the issuance of citations. It also begins with warnings. So after a couple of warnings and perhaps a dispersal order, there is the potential for the issuance of citations. They will also be checking up on locations that may or may not be following the rules and reporting back on places that have liquor licenses, that have gaming licenses, that are not following the rules, and those places will be subject potentially to having proceedings initiated against them to remove their gaming or their liquor licenses. And it's not just Region 1. It's in any region in which we have existing mitigations that we've asked people to follow, and we're going to ask the businesses, as the regulation, outlines, to do what they're supposed to do, and we'll hold them responsible if they're not.
And just to follow up to that, I know you want to get to other questions. And I'm sure you've seen online, a lot of people are not. They said they're done. Their livelihoods. They're not going to put their employees' jobs on the line. They're not going to, ruin a family business that they've had for 80 years, and they're determined to stay open. What are you going to do? I mean, what?
Well,
I know
let's.
you understand you don't want to ruin their livelihoods. I get that. And I know we want to slow the spread. I get that. But at what point in time, people are going to start fighting back?
Yeah.
And it's the best of the way that they know how, and that's how they choose to do it.
I understand, and I understand how difficult it is. I do. Many small businesses have their entire livelihoods at risk and the potential for the closure of their business permanently as a result of this virus. The difficulty, I think, is that some of the locations, and remember, this is often focused on bars and restaurants because those are super spreading locations, that some of those locations, when they remain open, when they don't follow the rules, they are, in fact, helping to communicate this virus to many other people in their communities. This is an awful virus. One of the challenges of it is that it isn't visible to anybody and it doesn't occur to you right away. In other words, it's not that you'll show up at a bar or restaurant one day and the next day you're sick. That's not how it works. And so it's very difficult for people to understand and then, to try to manage that with the financial pressures that they're going through. And we've tried to alleviate some of the burden of that with our business interruption grants, with PPP at the federal level. There's much more that's needed to keep people going financially through this pandemic. And we've been fighting to get those resources to small businesses in Illinois. And I'll continue that fight. For whatever reason that isn't happening, the federal officials, federal congressmen, senators, the president can't seem to get together to get that done. So what I can say is that, unfortunately, we still have to live by the rules here because we don't want people to get sick and die. And so I would ask people to try to live by the rules that we've set. Wear your mask. The truth is that if everybody will wear their masks, we can get our businesses back open again much quicker.
We are. I mean,
No, you are. I can see you're wearing a mask right now.
Yeah, but I mean, out in the streets and at bars, at gyms, even people running, jogging
Yeah.
alone, everyone seems to be wearing a mask, but it's
Yeah, that's-
not working. So what's?
That's not true, Amy. Masks work. There are a lot of people not wearing their masks, and a lot of people who are having private events at their home, and they're not wearing masks in their home. There are a lot of people, as you know, the unfortunate thing about bars and restaurants, as opposed to other kinds of retail, for example, is that in order for you to enjoy being at a bar or restaurant, you have to take your mask off. And it is often the case that people will sit for an hour, 2 hours, maybe longer, without their mask on. It's a place where you're speaking louder than normal, usually because there's noise in the place. I mean, the natural things that people do in bars and restaurants, unfortunately, are exactly the natural way in which this virus transmits. Masks work. Masks work. But I can tell you, because I have traveled this entire state, there are an awful lot of people not wearing masks. And right here in Chicago, that's true as well. But it's especially true in some other areas, and we're just asking people, please wear your mask. It is the most respectful thing you can do to help the businesses in your area stay open and help our schools get more kids in the classroom and make sure that our economy keeps going. Just wear a mask. We are getting through this because eventually there will be an effective treatment or a vaccine. We can see some of the development that happening. I think it will be early next year, I hope, I don't know. But we've got to be able to survive until then. We've got to keep everybody safe, and particularly people who are most vulnerable to the virus. Eric.
Dr. Ezekie, if I may ask you to follow up on the governor's statements. I know every day of this pandemic has been difficult. We're in a particularly difficult phase right now with the resurgence of the virus, and there is COVID fatigue. As you pointed out, people are tired of hearing messages from public health officials. I mean, What is the most difficult part of this phase for you on this day?
I mean, it's sad to see the numbers going up again. People have worked really hard to get us through the first phase, and as I heard from some healthcare executives yesterday, as we see the numbers go up in the hospital, people are bringing more beds, trying to prepare for the COVID units again, and these staff that went through all that pain to try to save as many people as they can are seeing history repeat itself. And so if you're talking about COVID fatigue from having to keep wearing a mask, think about the COVID fatigue for healthcare workers, respiratory therapists, who are going to have to go through this whole episode again of trying to fight for people's lives because we couldn't figure out how to control this virus by doing some of the simple measures that have been prescribed. I feel for those healthcare workers, the respiratory therapists, the nurses' assistants, all these people who work with the public on a regular basis. You cannot work from home as a bus driver, right? And so these people have to go to work every day as the disease is increasing throughout the state, and they're the ones that will be dying. And so putting our people through this again, it's unfortunate, and I'm desperate to find the message that will work. I'm looking for someone to tell me what the message is so that we can do what it takes to turn this around. The virus has caused this, and instead of pitting one group against another, we need to get that and fight against the virus, and we can do that. We have some tools to do that. We don't have a cure yet. We don't have a vaccine yet, but we have a mask, and we're asking people to use that, and I don't know what else we can say.
Well, a lot of people, their hearts are with you right now. Just can we talk about the school issue and how that's, our children, I know you've got high school kids, you have high school kids, a lot of us too. If there's a possibility that we could get our kids back, because even NPR, not a right-wing publication by any means, says that the risk of reopening schools has been exaggerated. Then there's been
Schools are making the local decisions on
Yeah,
that, so
may I?
you can address that quickly, and we gotta get online.
Okay, I will.
We have to shut down
Let me just say, we've never, this is, as you know, as we came into the fall semester, we did not shut down schools. Indeed, what we did was provide guidance for local schools to make decisions for themselves, because schools are different from one place to another. Their student bodies are different. They've got a different level of risk. They need to make those decisions at the local level with good guidance from doctors, and that's what we've provided for them.
All right, so Dana Rebick from WGN wants to know, according to the DuPage County Health Department, only 6% of outbreaks are linked to restaurants. Given that low number, why do you feel it's important to impose these restrictions on struggling restaurants and bars?
No, I appreciate that question. Let's understand an outbreak would be something if somebody works, like let's say in a manufacturing plant, and a lot of people work in close proximity, and then 50 people develop COVID in that setting. We would have that as a documented outbreak where this person knows that I was working next to this person contracted the virus, a week later, so did I. A week later, this person did, 3 days later. So that is like a clearly documented outbreak. In most cases of COVID, the person who has it cannot tell you exactly who they got it from. They're not saying, oh, I was working in this setting and all these people got it and then I got similar symptoms. So in the absence of a documented outbreak, all those individuals that did contract the virus, the way that you look at where they may have gotten it from is to look at the time frame from when you catch the virus to when you show symptoms or to when you're diagnosed. In those preceding 2 weeks, we ask the cases, where have you been? And all of those places that they list that they have been in the preceding 2 weeks are exposure sites. Any of those places could have been where they contracted the virus. And time after time, bars and restaurants come up as the number 2 or the number 3 place that all of those cases frequented. And so that's why we put it as a high, because it consistently comes up as a place that people who are infected listed as one of their exposure sites.
Jim Haggerty?
And
Yep.
I would just add, there are literally a dozen studies, many articles about these bars and restaurants being exposure sites and the effect of bars and restaurants on the spread of the virus, and that is why there is a focus on bars and restaurants.
Jim Haggerty at the Rockford Advocate is asking, as positivity rates rise, could a statewide stay-at-home order be implemented, or is the regional mitigation approach sufficient to prevent such a measure?
We are not considering a statewide stay-at-home order. We are, as you know, we created the regions and the methodology for resurgence mitigations precisely so we could avoid statewide stay-at-home orders. We've learned an awful lot since March, and so we're looking to, stick to the plan that we have.
Kelly Bauer at Block Club asks, Dr. Deborah Burke said closing public spaces isn't enough to stop COVID in Chicago. Can we expect tighter restrictions, and what is the state considering to limit small gatherings that are fueling the spread?
Well, let's begin by saying that it is true that just closing public spaces doesn't, solve problems, but we're looking at everything that we think is a high level of risk and trying to address it with some mitigation if we think it's high level risk. We're learning things about the virus still, even today. So are the epidemiologists around the world. And they are helping with the studies that they're doing, with the determinations that they're making, helping us to target better what we might do. But there's nothing more effective, I'm just going to say it again, than everybody wearing a mask and keeping 6 feet of distance. That's been the order of the day from the very beginning to today. It is the most effective thing that we can do. If we would all just take that responsibility and do it, we could bring this virus positivity rate, the number of cases, number of hospitalizations down relatively rapidly.
This is from Jake Griffin at the Daily Herald. Can Dr. Ezekie explain the science behind casinos remaining open but restaurants can't have indoor food service? Also, how is an enclosed outdoor tent different than indoor dining?
I'll take the easy one first. An indoor tent is the same as indoor dining. For the outdoor dining, we expect if there's going to be some kind of apparatus, tent-like apparatus, it should only have 2 sides. If it has 4 sides, you are essentially indoors. So that's for that. And then in terms of casinos, so indoor spaces are always trickier than outdoor spaces and obviously portend more risk. Casinos are large spaces, and so there's actually aggressive ventilation. They do keep that pumped with pretty fresh air because they're trying to keep people to have them be lively and awake and stay there and continue to spend. But in terms of the spacing, there have been very rigorous plans in terms of how to space, how to keep people away from each other, and those seem to have been followed. I will say that when we talk about exposure sites, I don't see casinos coming up as a place where people have been for cases who've been diagnosed with COVID. That doesn't seem to come up. So I would say that maybe the mitigation measures that are in place might be working, or maybe many people are not going there. But I think if we saw consistent information in terms of exposure sites and casinos coming up in Region 1, Region 2, Region 3, then we would have to absolutely reconsider that.
Jim Leach will be our final question at WMAY. Are congregate care facility outbreaks skewing numbers in a region, and should they be taken out in determining metrics for mitigation?
Well, remember that there are a lot of staff that work at congregate care facilities, long-term care facilities, nursing homes. They are coming in and out of the facility. As many of you know, much to all of our chagrin, we've had to limit the visitation of people to long-term care facilities by family members, by friends, and so on. It's limited now to just outdoor, visiting. And for a long time, it was limited. Literally, we couldn't let anybody in and out because we didn't want it to spread. It spreads like wildfire sometimes in a facility. And but the people that are coming in and out are the staff. And we can do, some number of things, testing being very important, to try to limit whether someone who comes in might have COVID-19. But as we know, there are asymptomatic people who don't test for it. Who can come into a facility too. We're trying very hard to keep those folks safe. And actually, in long-term care facilities overall, Illinois has done a great job since the very height of this pandemic of bringing those numbers way, way down. We're in the bottom half in terms of the number of deaths that are occurring in our long-term care facilities because of the work that IDPH and our administration has
All
done.
right, thank you, everyone.
Thank you.
Can you just reassure Illinoisans that the polls will be open November 3rd?